Hello, my friends. And thank you so much for coming to spend part of your Thursday, November 2nd with me. I can't believe it's November already. I have such a great show for you tonight. You're going to be so excited about this. So many of you sent me the video that Dr. Anthony Kaveh did on From Medical Secrets. That's his YouTube channel about Maya and medical gaslighting. And so I know a lot of you watch that channel. So I reached out to him to see if he would come on this show because we've been following the Maya case very closely and talking about it and analyzing it. And to my surprise, to my happy surprise, he agreed to come on. So I have him here with me tonight. So since we probably only have about an hour or so, I'm going to bring him in. We're going to talk to him. We're going to ask him your questions. And those of you who know him know that he is really the kindest, most compassionate doctor on YouTube. And I see a lot of you have already even said that in the chat. Look at this. Night Owl, this is going to be epic. My favorite YouTube lawyer and my favorite YouTube doctor together in one live stream. I'm excited for this. I am excited for it too. Heidi already says, can't wait. Dr. K is the best. AKA the cat lady. I'm so excited. I saw this doctor's video about Maya and CRPS. It was so kind and understanding. We need more people like this. Yes, we do need more people like that. And for those of you that are new here, I am Melanie Little. I come to you with 30 years experience as a trial lawyer in New York State and federal courts. I am also a legal analyst, commentator, and mother of 5. So you get all of those viewpoints from me. This has also become known as a kind place to watch the coverage of the Maya trial because we have so many viewers and subscribers that are diagnosed with CRPS and who also suffer with other chronic pain diseases. So they're in the chat. They are happy to answer your questions. My moderators are the best on YouTube, so keep it classy. There will be no personal attacks on me, my guest, or anybody else in the chat. But other than that, please come in, introduce yourself, and the rest of the chatters will be happy to speak to you. All that being said, guide your actions accordingly. And without further ado, I have for you Dr. Anthony Kaveh. Hello. Let me get you out of that cupcake. How are you, doctor? So nice to see you.
Likewise. Thank you for having me on, Melanie.
Well, thank you for coming on because that video that so many of my viewers sent me about medical gaslighting really struck a chord with so many people. So since there's probably some people out there who do not know who you are, I hear it. Is that a child in the background? I heard some kind of feedback. Tell the viewers, tell them your experience, your background, a little bit about yourself before we get started so they know where you're coming from.
Yeah, thank you again for having me on. I'm a Stanford and Harvard trained anesthesiologist, and I'm an integrative medicine specialist as well. So I like to look at the human body from a holistic point of view, if you will, not just as a bag of neurochemicals, but as one that is a cumulative sum of our genetics, the environment around us, including the people that influenced us growing up. You can't heal the mind without healing the body, and you can't heal the body without healing the mind. And if we don't acknowledge that as the cornerstone of medicine, it won't take us very far.
And I know that you do treat patients who have CRPS, right?
Yes, I do.
And so what can you tell us about CRPS?
CRPS is one of the more mysterious chronic pain conditions. It's not like normal, ouch, I twisted an ankle or I stubbed my elbow or I had surgery. Those types of acute pain are pretty easy to identify relatively because you have elevated heart rate, elevated blood pressure, your pupils may dilate, you may have it on your face. That's acute pain. Chronic pain is different because your heart rate has become and your body has become accustomed to the type of tissue trauma and the psychological response to that tissue trauma to the point where you can't just measure if someone's having chronic pain. Now, that makes chronic pain clearly more challenging to measure because we don't have a chronic pain meter. And now CRPS is a subset that's even more mysterious than just chronic pain itself because it involves doesn't even involve tissue trauma or tissue damage to cause pain. It really emphasizes and shows how pain is 100% in the brain. Not that it's made up or fabricated, but that it is a complex interplay of tissues, nerve and connective tissue, and the spinal cord, brainstem, and brain. Because CRPS fundamentally is, we believe, a disorder of the nerve conduction between anywhere in the body and the brain. And by treating one end, for example, the tissues itself, you might be able to fix the problem. By addressing the brain itself, you might be able to fix the problem, but without addressing both at the same time, it's harder to reach the best treatment you can. And that's where we do integrate, I think the word integrative medicine has in it, the best of Western medicine, the best of medicine from other parts of the world, including K-therapy.
Great. Thank you for saying K. I was telling you, I know that on your channel you're allowed to say the word because they have you certified on YouTube as a medical doctor, but the YouTube police are just really getting crazy. And I was telling you that last night I did a show on Matthew Perry and the perils of, I can't even say the A word, because the A word, apparently YouTube doesn't like that either. So last night's live stream that we did, or the video that we did, was immediately demonetized because apparently you're not allowed to talk about recovery either. They find that to be something that is, who knows. So we're going to use, for everyone in the chat, we're going to say K-therapy instead of the word. You know what it means. If somebody wants to spell it out in the chat, that's fine. So yes, we have to use safe words. I know. So integrative medicine, why don't you just explain a little bit about what that is? You touched on it a second ago, but maybe you could just elaborate on that a little bit.
The Western medical model is fantastic for treating things like heart attacks, strokes, doing surgery, but you can't, like we're talking about CRPS, you can't address the whole body by only addressing the biochemical reductionist view of medicine, which is looking at molecules and peptides, et cetera, et cetera. Very important. And I do this day in, day out in the operating room as an anesthesiologist. But if we want to look at the body as a whole, we do need to take into account that there's more than just a reductionist human body. There is the effect of everything else in the environment. And this is something that cultures around the world have known for thousands and thousands of years, whether it's Southern India and the Ayurvedic Indian tradition, and China and the traditional Chinese medicine tradition, in the Americas, all over the world, whether it's herbs or mind-body techniques. These play a powerful role that is more difficult to study than, for example, pharmaceuticals, but are also more holistic and address the whole body, mind, brain, spirit, whichever labels resonate with you. And integrative medicine aims to, as much as evidence-based possible, to bring these together to address the human being, not as just a bag of a water bag of chemicals, but as a human being that is deserving of a whole treatment plan.
That's interesting. So my viewers who have CRPS or have been diagnosed with CRPS have all been, they all have in common the fact that it was very difficult to diagnose, takes a long time to diagnose. And they also have said that they were often told at the beginning, it's all in your head, you're not really in pain, you're making this up. And I think that kind of goes to your video that you did on medical gaslighting. So if you could tell the viewers a little bit about what medical gaslighting is and what they can do about it if they find themselves in a situation where they're being gaslit by a doctor, a nurse, or some other medical professional, that would be great.
Yeah. And one of the peculiarities here, before I even get to that, is that when we say that it's all in your head, it's true in many ways for pain, because tissue damage is neither necessary nor sufficient to cause pain. You need to have a conscious brain to feel pain. And that might sound elementary, but it's actually profound because it does impact how we can treat pain holistically. Doesn't mean that it's made up or fake, but it is 100% in the brain. And a lot of my patients, after they've been gaslit for months, if not year after year, when they first hear that, sometimes from me, they actually go on the defensive. And I appreciate them, because it's going to be a defense mechanism, because they've been blown off and they've had their sanity questioned, if you will, through gaslighting from other professionals. But it's also important to not project that level of pain that other providers have inflicted on us onto new providers that are trying really hard to provide an accurate, holistic perspective that they probably never had before. So that being said, gaslighting, by definition, actually, you probably know, and your viewers may know, comes from this movie. and I don't remember what year this was, but in the 40s, I want to say, the idea was that the male character was trying to make the female character feel that they were losing their mind. So every day they slowly turned the lights a little dimmer, and the next day a little dimmer, next day a little dimmer. And anyways, after like a week or some period of time, the female character says, well, I think things are changing here. And the male character is like, nothing's changed. I mean, everything is the same as it was yesterday, to kind of incite that sense of incredulity, that sense of having their sanity questioned. So then when they ask questions and they share their concerns, they're being blown off because it's, once again, as you said, all in their head. Now, this happens, unfortunately, for some of the most complicated conditions in the human body because we don't have good ways of objectively measuring them. Chronic pain is an easy one. Migraines, another one. How do you prove someone's having a headache? You can't really do that. We don't have good signals on an MRI or on an EEG to be able to show that there is something going on in the brain. This happens for depression, for the A word that you said earlier. I almost slipped. But there's many real conditions that we simply cannot prove that have clearly tangible effects on the body. And this is where, once again, integrated medicine can help address all of them. But also the gaslighting can come up even with the most advanced experts. I mean, I was lucky enough to train in fantastic institutions, and I'm so grateful for them. But I know these institutions have caused gaslighting in innumerable individuals. I'm not pointing any fingers to anyone, but I'm just being honest, because in a busy day, if you're seeing 20 patients in the span of 5 hours or 4 hours, if there isn't a story that you can objectively verify, and there is to some extent something that involves what we call supratentorial components, that's the code word amongst doctors for something that involves mental health, then it's easy to say, oh, well, maybe it's just because of the mental health. Not looking at the whole picture where, no, there's, for example, in the case of CRPS, you have aberrant nerve functioning. No question about that objectively. Yes, there is, in many cases, that supratentorial component, but it's not, you can't blame everything on there. So you can imagine this leads to all sorts of conflict that the power dynamic of the physician and the patient easily leads into. So some of the common tips and tricks that I've recommended over the past are ways to level the power dynamic. That's the root cause oftentimes of gaslighting. So whether it is bringing someone else with you so that it's harder to gaslight 2 people instead of 1. I'm not saying it's antagonistic with the physician, but it's recognizing that if you have an advocate with you, it might be easier to not let those other truths about your past narrative be ignored by the professional. Not being in a gown and being half naked when you're talking to your doctor, even though sometimes they have us go into gowns there. It's harder to hold your own when you're not dressed properly with dignity, etc. Once again, it's not intentional, but it's something that you can always ask your doctor, hey, can I change, please, before we finish our conversation? Another one, which is very easy, is to be at eye level with your physician, because when you're standing up as a doctor and the patient's lying in a bed, helpless, vulnerable, etc., from a physical perspective, that's going to also add to the power dynamic, that delta between the patient and the provider. I'm not saying that the provider is not a professional who has incredible knowledge. Of course, that is hopefully the case. But there needs to be a level playing field in terms of respect and compassion. And if one is feeling like that is not being recognized or appreciated, at least addressing the physical barriers is helpful. Now, another way is to bring a notepad with you or notebook, because you can explain to your doctor that I'm just taking notes. I don't want to miss out on what you're saying. You don't want to come off as like you're grading them on what they're saying. But as a physician, I'll tell you, if a patient is writing things down, there's an implicit bias where it's like, well, let me be extra careful about what I'm saying. Well, I'm not saying that people are not careful when they're speaking and there's no notebook, but if you're in a situation where you feel that that power dynamic is being exploited perhaps, or is not being used in a healing or therapeutic way, that extra level of not even scrutiny as much as I'm really listening to you, doctor, I really want to make sure I get this right, will make it hopefully harder for that power dynamic to go in the wrong direction. Another very important word that is big in the medical world is the word plan, because doctors get paid to come up with plans, like many other professionals, we have a responsibility to come up with a plan. We assess the patient in the plan. The plan is where the money's at. It's whether it's a medication, whether it is a lifestyle intervention, whether it is a surgery, whatever it is, the plan needs to be clear. The doctor has to be clear about it because we have to submit our paperwork ultimately for payment. But sometimes there's a breakdown in communication between that plan and the patient, who is the biggest stakeholder in the medical system. So if one is feeling like they are unclear, which is often what happens in gaslighting, because there's this power dynamic being exploited and things are being brushed off, and perhaps frustrations or concerns or fears are not being addressed or acknowledged, one can ask, what's the plan, doctor? And if the plan is unclear to you, that is your opportunity to say, doctor, thank you so much for explaining that. I'm still not clear. I still am not sure what you mean. Doctor, what happens if in 1 week something hasn't changed, et cetera, right? But it's your responsibility. It's your physician's responsibility. And it's your right to know what the plan is for your medical care. And if there's anything ambiguous about it, you need to be comfortable speaking up for yourself, whether an advocate comes to your appointment with you, a family, a friend, whoever. But at the end of the day, you need to have that confidence to speak up for yourself. Once again, non-confrontational. You're not attacking anyone. You're just trying to come from a place of curiosity of, doctor, I really want to make sure I know what to expect. I hope those are 4 or 5 tangible things your audience can take away.
Well, what's so interesting about all of the things that you said is that Beata Kowalski did so many of those things. She, in fact, recorded so many of the doctor's appointments that she went to. She videotaped them. She was a great historian. And when she brought Maya into the hospital, she advocated for her child. So all of the things that you're telling people to do is exactly what Beata did. And they sort of like crucified her for it. It was almost like they didn't like the treatment that she chose for her child. And because of that, they decided that in their infinite wisdom, a doctor who met Maya for 10 minutes, Dr. Sally Smith, accused Beata of medical CA, we have to call it, because we can't say those words on YouTube either. But perhaps you can tell us a little bit about K, the drug that we can't say, and what it is and what it's used for, and if it's helpful for patients with CRPS.
And you are touching on the fact that we can be doing everything right in life. And you and I both know as professionals that bad things happen to good intentioned people time and time again. That being said, there's a saying in medicine that nice patients end up last. So it's not saying that people should not be nice and respectful. I mean, nice is one thing, but being respectful and compassionate and responsible, they're not all the same. So while unfortunate things do happen to the best intentioned people, we can minimize those chances by being an advocate. And that's what I'm talking about. I'm not saying I have a panacea or a magic pill that will keep you out of harm's way, just to be clear.
No.
Now, there's a couple of wrinkles to this story that make it, that unfortunately add up to many of the things that we see in this case. And the first of which is the use of ketamine kind of at the wrong time in history. In the year 2000 is when the first papers started being published on the effects of ketamine for mental health. And up until that point, ketamine had been used pretty much exclusively as an anesthetic. We use it in the operating room today for general anesthesia, for sedation, and anything in between. But using it for chronic pain exclusively in that time for Maya in a different country where there is this, call it stigma, call it reputation, call it whatever you want, about using things off-label, which we do in the United States every day, but you're in a different country at a point in history when ketamine is not, K is not being used for this, and you are going to inherently stoke the implicit biases of providers who are looking at a young child having a very unusual therapy in an unusual setting in a different country, etc. So to be clear, K can be used for CRPS. There's 3 randomized trials that have assessed it, and they weren't all published at this point in time. So that's one reason why there is, in some ways, rightfully so, some skepticism. But even those trials, to be clear, have not advocated for K comas the way that, as I understand it, our dose is so high that have led to being effectively under general anesthesia. Now,
Right.
the reason the K coma is talked about, not often performed as much anymore, is because the effects of K for general anesthesia are, let's say, dose 1. For mental health, typically we're using doses of like 1/10, meaning like very, very low doses comparatively. When we use K for post-surgical pain, it's also doses like 1/15, very low. A K coma is putting someone in a dose of like 1 or 1.25, very high doses compared to what anyone had really has ever been doing for mental health, which has been the main use of this outside of chronic pain. But CRPS, like I said, is different than other forms of chronic pain. It involves aberrant nerve conduction. And quieting down that nerve conduction to a level to allow for what we might call a reset requires significantly higher doses of any anesthetic, because all anesthetics turn off nerves. It's how they turn off the nerves in your brain so you don't remember being awake in surgery. But to turn off nerve conduction throughout your body requires even higher doses than what is ordinarily used just to turn off the brain. It's because the brain is more sensitive to anesthetics than nerves throughout your body and spinal cord. They are more resistant, therefore they need a higher dose. So if you're trying to use K to turn off nerve conduction, you need whoppingly high doses compared to the mental health doses or those for just regular post-surgical pain, for example. So if you're going to use K at those high doses, the person is not going to be awake. They might need support with their breathing. That's why they need to be intubated. So now you're introducing the risks of general anesthesia, breathing tubes, and all the risks that come with that for an unproven, relatively unknown therapy at that time, over 10 years ago. And you're doing this to a child, which, as you know, children and pregnant women are the most like untouchable group
Right.
when we're looking at drug studies with pharmaceuticals. Now you're going to use an off-label use of a drug. It just raises red flags left and right, especially for someone untrained in this particular type of therapy or unfamiliar with something as debilitating as CRPS. But to be very clear, the reason why this was done is because in everything in medicine, you have to weigh risks and benefits. The risks I just shared with you, there's a bunch of them for a K coma, very, very high risks. But the risks of untreated chronic pain include what? Include depression, anxiety, PTSD. I hope none of those are words that you wanted me to use
No, we're
code
good.
for.
Exacerbation of the condition. Yeah.
Yeah, right. And what are the side effects of untreated? Well, what are the side effects of those? Well, in the developing brain, well, let's make it even easier. In the developed brain, and you or me, if I had a sudden major depressive event in my life, there is a very high chance that there's going to be a permanent IQ hit for me for the rest of my life from that major depressive episode. So the developed brain in an adult, there are sequelae and side effects and consequences of undertreated or untreated depression, anxiety, PTSD. The developing brain, you have even higher risks. Now you're setting up an individual for a lifetime of all those conditions, plus the sequela of them. If you look at the adverse childhood experiences list, you'll see that heart disease, lung disease, et cetera, everything lines up on there. Many will go on to even say that autoimmune disorder and cancer are related, and they certainly are as secondary outcomes, but maybe even primarily they're also related. But my point is that when you have a young individual with debilitating pain, it's also inappropriate to leave that pain untreated or undertreated. So you need to do something. And this is where reality and sometimes an ivory tower, whether it be academia or whether it be a big hospital setting that is only following a protocol and not looking at the individual patient, there can be friction here. You can't leave somebody undertreated or untreated because the risks of that might be greater than a old drug used for a new purpose in the case of K. Remember, K has been around for over 50, 60 years. It's not a new medication by any means. So we need to not just be bound to a protocol, because every individual who comes to us as a physician has the right to be treated as a human being, not just as another you know, item on a meat packing factory line and just being
Right.
moved along.
Right. And in their defense, and they did try a lot of more conservative treatments before even getting into K. They did the PT, they did the OT, they did the CBT, they did, psychological stuff on her. So it was, I think, if you're familiar with the case, almost a last resort. It was kind of the last thing they tried. And it seemed to work for her. I don't know how familiar you are with the actual, doctors that treated her, but they came to Dr. Kirkpatrick after a while, who was in Florida, who started treating her with infusion therapy. And then after that stopped working, that's when he sent them, or they went to Mexico and saw this Dr. Cantu, I guess, for the 5 day K coma, as they're calling it. But as you're saying, it's not really a coma. It's just going to sleep, I guess.
Well, that is a coma.
Yeah.
I'm not, nothing that you're saying, I'm not disagreeing with it.
Right.
Anesthesia is a medical coma. It's not going to sleep. If you
Okay.
put electrodes on the brain, it doesn't look like sleep at all. It's fundamentally different. Doesn't mean it's good or bad. It's just, it is what it is. But what you're saying demonstrates that people are trying to do the right thing. We don't want to use experimental techniques, or what at the time was experimental, in a child, because the consequences to pregnant women, or I don't know, pregnant people, people with the capacity for pregnancy who are pregnant, whatever the term is, no disrespect meant to anybody out there, and and children or people with a developing brain, the risks of side effects are higher. So I'm just sharing with you that people will shy away from doing anything semi-experimental to these two groups of people. But at the same time, we can't forget that the risks of something going wrong, even in pregnancy, it's not the topic of today, but untreated problems in pregnancy also can lead to all sorts of complications for mother and child moving forward as well. So it has to be a holistic view once again. And I think that on one hand, clearly there was advocacy on the part of the family members, and there was some resistance to some degree in the reception of that by the hospital staff. At the same time, I don't want to go into the specifics of who's right and who's wrong, but it is important. I will share that when some family members do come in advocating, it's sometimes misinterpreted as being pushy or as being overly authoritative or as being aggressive, and fill in the blanks for other words. And this is what saddens me, is that there's not more discussion about this, because why is it that someone who desperately wants the right thing to be done for their child, assuming that it's not CA, like you said, and doctors that also want to presumably be doing the right thing for the patient, can end up in complete polar opposite ends of the spectrum here, leading to some horrible indelible event in the part of Beata. And that is what I don't hear people talking about.
Yeah.
Why is it that doctors are not able to hear what's going on? Is it because the system is interfering? I believe it is. Is it because there is a tremendous inertia in medicine to adopt new techniques, recognizing urgencies when they present themselves? I agree. I believe it is. Is it because there's stigma against medications like K, and if you want to call it war on D? Yes, it is. Is it because chronic pain is immensely poorly understood and gaslighting is at play for institutional and medical reasons? Yes, it is. Anyway, so no one's talking about the multitude of other factors that can help prevent this from happening in the future, unfortunately.
Right. Well, what we're talking about, and what we have been talking about while I've been covering this trial, is the very, very scary proposition that you as a parent can bring your child into a hospital and within 48 hours have your parental rights stripped by a privatized CPS system, or DCF as they call it in Florida, based on a false accusation of a doctor whose specific job it is to find medical CA, because it's a privatized system. So we've sort of been focusing on that that's a really scary thing, that because and you're losing the right to choose your child's medical treatment, and that's really frightening. Whether they agreed with this treatment or not, it begs the question of, when a person's parental rights are stripped with regard to their child's medical treatment, in my opinion, that's a really big problem.
And you hit another, no pun intended here. You'll see why I said it in a second.
Right.
But we have this saying in medicine and everywhere, really, right? When you're a hammer, everything is a nail, right?
Mhm.
Everything looks like a nail. So when you have people specialize, like you said, in performing one function, and it's like this whole blinders thing. It is the opposite of a holistic view. And like, how could you? I'm not going to take sides on anything here, except to say that when surgeons look at a bummed knee and I look at a bummed knee, we're going to have different recommendations. Not
Sure.
always, but in most cases. I'm not saying I'm right and they're wrong, but I'm saying that if we don't look at someone as a whole, how easy is it, because we're human beings, to fall into the funnel of what we're being paid to do? I'm not saying it's bad to be paid for your job, but we
Mhm.
need to be doing human being instead of human doing. Human doing is just driving on the highway with blindfolds on, just autopilot. And too many
Right.
people in healthcare live in autopilot. And you're hitting it directly on the point there, hitting
Yeah.
the nail on the spot, no pun intended.
Yeah, right. And this was after confirmation by the treating doctors that she did indeed present to the ER with a diagnosis of CRPS. And in fact, if I tell you that Johns Hopkins All Children's Hospital had treated her for CRPS in the past and also installed the port in her for her K infusions, they were on notice that this child had already been diagnosed. They confirmed it with her treating Dr. Kirkpatrick, not once, but twice. And then this doctor chose to leave it out of her report to the court. And that's why we're here. So all of those things are very troubling in my mind.
Well, we also have this issue with the social worker, whom, once again, I'm not going to take sides here, but there is a certain
I
amount of
am. No,
circumspection
good.
about what is
Good.
going
Good
on
sense.
here as well. And
Mhm.
I don't think we can look at this without the interference that was run, at the very least, based
Mhm.
on someone who, to my understanding, had never even really seen a case of CRPS, didn't know what it was.
Right.
Certainly not how to use. I mean, you can't. And this is, I need to speak on this because it's in the medical profession, we have really given up so much of our compassion and our responsibility to those that don't have the same training because of what the system has forced us to do in some ways. I'm not saying that social workers are bad. I'm not saying that PAs, physician assistants, are bad. I'm not saying absolutely not. But I'm saying that we need to know what the scope of our practice and our training is. And if one is not qualified to make a judgment about something or a decision about something, you need to be very clear. And there need to be consequences for making a decision when you're not qualified to do so. I'm not saying that, I want to be respectful and compassionate here,
No.
but I tell my patients all the time, I'm not a surgeon. I'm not an endocrinologist. I'm not going to solve your thyroid problems. I think Clint
Right.
Eastwood says a man's got to know his limit. Whatever
Right.
a person has to know his limit, whatever, to be, gender or whatever.
Right.
But my point is that I need to know what I'm not going to be comfortable with. I'm not going to pretend, because people will suffer. And if I'm not accountable for people suffering based on my decision, then that's not fair to the patient. So I am responsible. I have to call patients at night. I think about them. They keep me up in the middle of the night, because not because I'm not a saint, Melanie. I'm not anything social. I just have a
But you took an
responsibility.
oath, right? You took an oath. I mean, that's do no harm. I mean, that's
Of
putting your
course.
patients first, and that's a wonderful, compassionate thing that you should not apologize for, in my opinion.
I don't think people just have to take an oath. It's just that if you have a responsibility, you had to uphold it. It's not
Mhm.
about, right? If you're a social worker or
Sure.
whoever you are, if you're an administrator in a hospital, you have a responsibility. And that's to, right? You're a servant to someone else. As
Mhm.
a doctor, you're the servant to the patient. But even if you're someone else, but all I'm saying is that there is a tremendous amount of overstepping boundaries. I don't understand how anyone would be so comfortable doing that.
Mhm.
But I see this every day. I mean, this is what all doctors, um, no one speaks up about it, unfortunately, but we see people encroaching out of their territory all the time. And it's amazing that bad things don't happen more often. I think it's because oftentimes the other professionals swoop in to clean up the mistakes and prevent someone from falling, catching them. But this is a case where no one swooped in to catch the person as they fell, and he saw what disastrous consequence happened. This is like the tip of the iceberg for how many potential things do happen every day because of a broken system that the health professionals work. And anyway, it's not a soapbox. I'm just sharing a reality. This
No,
is
well, yeah.
why. This is why patients have to be advocates for themselves, because nobody cares more about your health than you do.
Right. And
Or,
nobody knows your body better than you do either. Like if a doctor tells you, there's nothing wrong with you, you know your body. Go get a second opinion. Go get a third opinion. You know when something's wrong. If somebody tells you it's not wrong and you don't believe them, keep trying. Right. I mean, that's one thing that we're doing on this channel, at least by covering this trial, is to raise awareness of things like CRPS. I made a whole Team Maya merch line. If you might see that in the bottom of the video, and all of the proceeds are going to CRPS research, because it is a disease that until this trial, so many people were not even aware of. To raise awareness of being an advocate for yourself with your medical providers and with your hospitals, and for being aware that this can happen, that your parental rights can be stripped based on a 10-minute interview, if you will, not even a physical exam, of a parent, and a false accusation of factitious disorder, which is, or conversion disorder, what they wanted to. And that's why Maya's parents would not agree to a transfer to another hospital, because they wanted to transfer her to a psych hospital with a diagnosis of factitious disorder, which would have stayed on her record forever, as you know. And that's why her parents fought the transfer. So there's so many issues here that are intertwined. But since I have you here and you're the K expert because you use it in your practice every day, right, in the operating room.
And in my clinic, by the way, where
yes,
I use K more often outside the operating room now than I do inside the operating room, because I'll tell you very quickly, if you want to know why. Patients ask me all the time. It's because when I realize the effects that anesthetics, not just K, but really any of them, K in particular, can have on somebody in such a traumatizing time as surgery, I thought, well, you can have these incredible beneficial effects from a combination of a medication, a compassionate, caring guide, like your doctor, your surgeon, your nurses, whoever, that despite a physical trauma like surgery, you can come out with your mindset better. Why don't we do this for individuals without the surgery part, so they don't have to be recovering from a surgical trauma? And that's what prompted me. It's kind of, and the culture, I've been doing this for a long time. I personally didn't buy that culture. I'm what you call a straight arrow. I'm not big on experimenting and things, but I just couldn't disregard or ignore the need for something. Goes back to this ivory tower approach versus reality. People are suffering. We have a fantastically effective and safe treatment when done in the right medical supervision. And yet we're here still debating while people are out here dying over ODing. I don't know if that's the right word, right? I mean, suicide in young people. This is absolutely insane.
It's an epidemic.
What's going on? And we have treatments, and we're still we have all sorts of inappropriate words that doctors joke around to describe this type of behavior of just people that don't want to move forward. Sorry, I don't mean to be mean to anyone, but it breaks my heart when we have so much knowledge and so much potential that's untapped. And that's just what I want people to know, that if you don't advocate for yourself in a respectful, compassionate way, you're not going to help push people to uncover, and be empowered to do the best for you, and vice versa.
Yeah. Here's an interesting question from Julia. Julia Cochran says, how does K actually work? Does it work on the nervous system?
K, like all anesthetics, works on the nervous system. It turns off at a high enough dose nerves, but it's this funny dose response, if you will. So some anesthetics, the more you give, more or less, the more you turn off nerves. In fact, if you give enough of any anesthetic, you will eventually turn off the nerves in your heart, which will lead to cardiac arrest. So you can't just give infinite amounts of any of these medications. But K is peculiar. It's the closest anesthetic medication we have is laughing gas or nitrous oxide, because these two medications actually have a sweet spot where they activate parts of your brain, specifically the neurons in your brain, in ways that kind of mirror, in some ways, what your dreamlike state is like, or what your non-autopilot brain is like. And if you're wondering, why does it matter? When we're in autopilot, everything, many things get worse, not everything. typically the rumination and perseverations of depression get worse, of anxiety get worse, of chronic pain, of you name it. Nearly any condition left with unmitigated rumination perseveration will get worse because it's the autopilot of your brain. When you are not in a good mental or physical space, your body sinks to its most reflexive habits, and they're often our comfort zones or our familiarity zones, and they're not good places if you're not in a supportive environment. That's autopilot, and the brain has a very signature pattern. We call it the default mode network, DMN, if you do a Google search. So what K and what nitrous oxide do, but K really more so, is it actually turns off the DMN, which you can also do, by the way, in meditative states, in dreamlike states. There's many ways of doing this, but in individuals who are in deep chronic pain with CRPS, for example, or anxiety, depression, suicidal thoughts, etc., you can't just tell them to go and, hey, go meditate for a week. It's like, forget the fact that you have a job.
Just snap out of it. Right, exactly. Just snap
out of it. Aren't there people around the world who are starving? You have food in front of you. You should be grateful that you have food, right, Melanie?
Right.
You can't compassionately do that. And this is where, if you don't know what depression is, like you have to commiserate with the individual. You have to know what they are stuck in. It's a stuckness where you are in a pit so deep you can't see any light over the horizon, and you're stuck there not just for one night, but for weeks and months and years on end. I think of, like, in Lord of the Rings or in The Hobbit, that golem little guy that had these big eyes. It was like stuck in a cave in that mountain or whatever. My point is that it's like being stuck out of sunlight for years. Your body transforms just like the little creature did in the book or in the movies. And you can't just snap out of it. You said it so well, Melanie. So by virtue of affecting the nerves, specifically in the brain at particular doses, K has this very powerful effect. At higher doses, like I said, it can turn off the nerves in other parts of your body, the nerves that conduct pain, and that seem to be misfiring. The connections are not normal in CRPS, and that's why higher doses are used for that. But yes, it affects all nerves in the body.
Interesting.
Good question.
It's so interesting that you mentioned nitrous, because nitrous is something that my kids get when they go to the dentist.
Yeah.
So that's approved in children, and if you're saying it's a similar thing, look, we see off-label usage of drugs all the time. Right now, the biggest craze I can think of is Ozempic, that people are using Ozempic for weight loss, right? That's what they're using it for, and it works. So just because it's not FDA approved doesn't mean it's not working, I guess, is my point there. Let's see. Speak Life, Garden Homestead, and Permaculture says, if you're in pain and go for other opinions, they flag you as a drug seeker. They treat pain patients like parolees or criminals.
Yeah, this is a big one. And when you said earlier that factitious disorder, conversion disorder, functional neurologic disorder, etc., they stay in your chart forever, so do these labels that viewer just mentioned.
Mm-hmm.
And then what happens? Yeah. You know what happens in the emergency room when you come in, and what's the first thing the doctor does when a patient comes into the emergency room?
Tell me.
So they look at the vitals first, make sure that their heart rate isn't 0, it's not 200. The second thing is they look at the last note. You look at why they're there. Like there's a one-liner that the triage nurse puts in. That takes about total 5 seconds. The next thing you do is you look at the past note, typically. And if the last note ends by saying patient came in for 5 milligrams of D or hydromorphone, if you want to use, I don't know what words are. But,
hydrocodone.
One of these pain medications derived from the opium plant. I don't know how much I can say on here without being flagged.
At this point, who cares? This is an important topic, and really, the 50 cents they're going to pay me on the views, let's just go for it, because it needs to be talked about, and I agree with you.
And AKA the cat lady is saying the same thing. Well, there's unfortunately an implicit bias once again that comes in from a doctor that has, 5 minutes to spend with a patient who's coming in for pain. And they have a patient who's dying of a heart attack next door. I'm not blaming anyone here. I'm just saying that realistically, how is this system designed to do anything but fail patients in the end? When you have I mean, the ER that I have close friends who work at next door, there's one ER doc manning the whole emergency room. All right. And you literally could have a stroke and a heart attack and someone coming in for a chronic pain exacerbation, all three of which are vitally important to that individual to be treated. I mean, I'm not saying any of these are necessarily more or less of a problem, but of course, one human being can only do so much at one time. And when you throw into the mix a little implicit bias that, like you said, quote, drug seeker,
Yeah.
and the system is set to fail. I mean, how are you doing anything but supporting the system? This is the exact opposite of what we said, a holistic view, right? How can you possibly funnel somebody with such a past history and narrative of medical conditions into drug seeker? Hey, they exist. Melanie, I need to be very clear. There are
Right, sure.
so many that come in and they suck up so many resources. And it's very frustrating as a doctor because the system does not have an adequate way of treating them. I'm not blaming the individuals per se. I want to be very clear. I'm not blaming drug seekers. But when you are an addict and you get labeled as an addict, it's like, yo, that is a symptom. The diagnosis should not be addiction, at least not in most cases. That individual needs something, that the addiction is there to help temporarily remediate. Yet in an emergency room, can you possibly have the resources to go in and like say, hey, you're here for like pain again. You just got a refill last week. Is it really like physical pain or is there something else going on? I'm not saying they're fabricating their need for pain medications, but you can't disentangle the need. Is it a need for connection, for compassion, for care? Is it another physical ailment going on? I mean, there's a million things that are going on. You just label it as addiction. But anyways, the ER is not the right place for that to happen. Yet that's where patients are. It's like when they've reached their lowest of lows, they come into the ER. You don't go to the ER unless you really need to. If you've been to an ER, you know what it's like. You're waiting in line
7
for like,
hours, right?
yeah. And there it stinks, it smells, like people are groaning. It's not a pleasant place. And the least you can do is like not treat them like, a low life, I guess. But
Yeah.
it's a very tough situation.
So we're seeing so many more urgent cares open up. People would rather go to urgent care because you're in and out in an hour than the ER. If my kids get injured, that's where I take them, to urgent care, because I don't want to sit in the ER for 7 hours, right? I mean, it's interesting. So you use K-Therapy in your clinic, right? I mean, so that we're open, it's clinic or a facility. What do we call it? A clinic?
It's a clinic. No,
Right.
I purposely stepped away from so many others that wanted to do this. And it's because, unfortunately, nothing against a capitalistic culture or whatever. Not my point about commenting on that, but it's that if you want to really do a holistic, I don't want to keep saying this word holistic, but like, I don't know if there's a better word for it. You got to look like the human being as a whole, not just a meat bag, but like a human being deserving of your full focus and attention for an hour. You can't do that in the medical system. No hospital, no other facility allows for something like that. And yet without that, patients are going to continue to flail and flounder and be labeled as a drug seeker, etc. So anyways, I had to step away from the conventional system for that part of my life because I am not aware of a good way of doing it, especially not for complicated medical cases. Of course, I think that there's a role for all sorts of psychologists and nurse practitioners, et cetera, to take care of more straightforward cases. But when you have something like CRPS, this is not something that you can just, hand off to a mid-level provider. No, nothing against them, but these are often complicated medical cases.
Hence the name, complex, right? Complex. Regional pain syndrome. So you use it in your practice for not only things like chronic pain and CRPS, but you've also had a lot of success with depression and anxiety patients as well, and also for addiction, right?
Which is surprising because K can be a drug of abuse. And yet here you are. And we have had results that blow my mind in how it can turn people's life around by addressing, once again, what are they seeking? It's not the addiction. You can't just label people as addicts and expect the problem to go away. And it's funny that there is, I live in California, obviously, and I email Sacramento. I try to talk some sense into what I feel is this horribly broken political system as well as the healthcare system. And it is sad to me that our greatest pushes in healthcare are expanding mental health care access, expanding access to this or that. And it's like Suboxone,
Right.
uh,
I was gonna bring that
methadone.
up. Yeah, Suboxone. Like, is that just, giving someone who's trying to quit OxyContin, Suboxone? Is it just replacing one narcotic with another, or does it work?
Very, very good question. So this is where we need to talk about bridge versus destination therapies. A bridge
Mhm.
therapy is something that's getting you to a different way of living. A destination is like, you're going to die with this. I'm not meaning this in a bad way. If
Mhm.
you, Melanie, had your thyroid removed, well, we can't give you a new thyroid. We have to give you thyroid replacement, call it levothyroxine, Synthroid, whatever, right? That's a destination. You're going to die taking Synthroid. It's not morbid. It's just a fact. There's no
Right.
other way. But if you came in for a broken ankle, you might get 10 NORCOs, and hopefully you won't need to even take all of them. But then your body will begin to heal itself so that the painful stimuli and the tissue damage is not there to exacerbate the painful sensation in your brain, right? So that is a bridge to your body healing, for example.
Mhm.
Suboxone, which is buprenorphine plus naloxone, is a um, different beast. It's buprenorphine is unlike other types of pain medications, but it is, in my experience, I'm not seeing people go on Suboxone and then come off of it. I'm seeing people on Suboxone
Right.
for years and years, and then that's a destination therapy, and it's like it's not quite an opioid in the sense it is an opioid, a synthetic opioid. At least it's um, different in many ways than oxy, but you're still putting a band-aid over the root cause. And
Right.
there's side effects and there are costs to all of these things when maybe the majority of these individuals, maybe not all, but the majority could actually find healing within themselves if you opened up pathways for them, which is what we use K for, to tap into the inner healing potential.
So it's a psychedelic in that. Okay, listen, I followed the Grateful Dead around for my whole entire life, including now, so I'm well versed in psychedelics. Not that I've ever used them or anything, but so in your practice, is it in the class of psychedelics or the class of anesthetics?
Yeah, it is an anesthetic. Now, it gets a little bit semantic because we often refer to psychedelics as having particular chemical structures. K does not have this particular structure that serotonergic based psychedelics have. I want to be careful with the words that I use here, but
We're past that, I think now.
I
It's too
know,
late.
right?
It's too late for us, Dr. Rout.
I know, I hear you, but I don't want to be overly semantic about this. It has an effect of what all psychedelics accomplish, which, as the name is, it's mind manifesting. The goal of an experience like this, which, by the way, I want to be very clear, you don't need psychedelics to achieve these, right? Once again, we said deep meditative states. I mean, you can read accounts from meditators from all over, every corner of the world has people that have described these types of states without our knowledge, using the organic natural forms, which are often derived from mushrooms.
Mhm.
That being said, K was just 2 years ago discovered to actually be formed in fungi as well. So it's actually naturally occurring, though we didn't know this for the longest time.
And if I may also point out, mushrooms have been legalized in many states recently, Colorado being one of them. As you can see, I'm a Colorado Buffs fan. I went to college in Boulder, and Boulder was one of the first places to legalize just about everything. But, ayahuasca therapy, like all of this stuff has been legalized in a lot of places.
Well, we can
Just
talk
saying.
about this. This is a very interesting topic if you want to get into this. There's dangers. So on one hand, I'm always saying that, hey, we want to use available treatments safely when we can do so to mitigate the risks of under-treating conditions. And I actually had a very, very candid discussion with Sacramento about their recently proposed bill to decriminalize psychedelics. I was actually against it because of the way that they were
Mhm.
bringing it forward.
Right.
Um, Once again, I'm not anti-psychedelic, but I got to look at past precedent and how does a system, like, what is the end result? I don't want to have our eyes closed to reality, because reality sounds fascinating and fun. Everyone's going to be, cured of depression and anxiety, and they're just going to be living life. We're going to cure everything, right? Well, let's look at the closest example in time, marijuana, or once again, MJ, whatever you want to call it. So in California, when MJ was decriminalized fully, you don't even need a card. I mean, I live in San Francisco. I can walk out this, I can practically get high just walking on the street because
Oh
of
my
this.
God, New York City too. It's not every corner skunk. It smells like skunk. It's kind of gross. So I agree
Well,
with you. Yes,
so
it's a problem.
and what has it accomplished is my question. I'm not anti MJ.
Mhm.
Like, hey, MJ has been used for millennia because it
Yep.
does work for some things, but within a very short period of time, it allowed this unnatural plant now, because we're talking about THC concentrations well above the natural 2-3%. Like, I can get there, they even call it an anesthesia strain actually in my local dispensary. It's upwards of 30% THC. I can go get that. And this is no longer the natural. If we're talking about the psychedelics that you referred to that
Mhm.
are natural, because natural plant forms are typically much safer than pharmaceuticals, because we can talk about that later on. But bottom line is they have not been refined in this reductionist view to only have one molecule. But now what happened with this decriminalization, because there was so much money to be made, in MJ, that it immediately went to what the market was, which was unfortunately exploiting young individuals suffering from all sorts of pain, chronic pain, and psychological disorders, and have gotten them. People say that you can't be addicted to marijuana, but there is absolutely a cannabis use disorder.
Psychological dependence, I would say.
Oh, absolutely. We see this in the operating room, in the emergency room all the time. And I'll be honest with you, Melanie, it's one of the weirdest things, because
Mhm.
this is not everybody who uses, takes a hit here and there. Absolutely not. But for daily users, this stuff affects the brain in ways that we are still learning about. One example, the amount of anesthesia you need to fall asleep. You might need more than 2x the amount of anesthesia to fall asleep if you're a chronic weed user.
Because of the tolerance level.
What is happening to the brain? Exactly, Melanie. This is not. This is very concerning to me,
Yeah.
because this
Especially in young
isn't.
people when your brain is not even yet fully developed and now it's legal. So they think, all right, it's cool. It's legal when I'm 21 at least, so it's not so bad. And, you're getting chronic users who are teenagers and younger. It's a big problem.
And they're advertised like it's natural and it's
Mhm.
safe and there's no side effects. And this is where, so my question for Sacramento was, if you're going to decriminalize, great. What is this support around this so that we make sure that individuals are educated and using this safely? Because there are absolutely risks to unmitigated
Mhm.
cannabis use. I mean, clearly, I just
Yeah.
explained a couple of them, but there are so many more. When they come to the ER, it is the weirdest presentation, because I'll tell you, call it cyclic vomiting syndrome.
Mhm.
It's this, and I don't mean to anger anyone in your audience. I really don't
No.
mean that, but it's a public health need here to recognize that they come in vomiting, vomiting, vomiting. They come in with a partner. The partner's like, oh my gosh, they can't stop vomiting. The only thing that helps is a warm shower, and the only thing that also helps is more weed. And it's like, have you ever stopped the weed and see what happens? Yeah, I stopped it for like a day, and it's got worse. And it's weird because cannabis can help nausea and vomiting in some cases, like with chemotherapy, but it can
Yeah.
also cause it. This is not just a straightforward plant. And then you add on top of it um, all of these other strains that are completely unnatural, just
Right.
designed to make money. And
Mhm.
now it's like there's just no regulation over it. And young people are suffering, old people are suffering. And I see it in the OR, and I'm just like, did no one ever tell you that this could happen to your body? Like, no. And I'm like, this is not a conversation I should be having with a patient before they go under anesthesia, when they're smoking a joint in the parking lot before they come in, for
Right. Or
example.
a pen. Now it's in a pen liquid form, this liquid. It's all synthetic. It's like the Juul, nobody thought smoking the Juul was bad until all these kids turned up with popcorn lung. But we could do a whole other show on this, and I suggest that we do. So let's not digress too far, because I don't want to keep you here all night, because I could
Yeah.
talk for hours about this, because I could. But let's see if we have a couple of questions just to stay on topic with the Maya
I
case.
agree. Thank you.
So yeah, because I will totally, if you want to come back another night, I will have this conversation all night long with you. Let us see here. Christina says, Oh, you went on mute. I asked my pain management doc about K-therapy last week. He said it's a phenomenal treatment that doctors have known about for years. He encouraged me to try it. Now I just need to find a resource in LA.
I've actually done a video on this. I encourage people to check it out on what to watch out for in the scams of K-therapy. And there are so many unethical practices because you have still, even though it's been 20 plus years, it's still not covered by insurance for a number of political reasons, which we're happy to talk about later on if you want, about why there is no FDA approval and therefore why there is no insurance reimbursement for it for similar reasons, at least. And here you are with a out-of-pocket, semi-expensive, because it is a powerful treatment that requires medical supervision, that you have a vulnerable population for. And if you don't smell the potential for irresponsible actors, well, then you're not in touch with reality. I'm just being honest. We have so many patients that come to us who've been like, wow, like, what on earth was this last clinic I went to? I had no idea what was going on. I was terrified. And it's like, how can you take advantage of poor people like this? It's just, it breaks my heart.
So you're in the San Francisco area. So in case people want to find you, they can go to your channel and they can find you if they're in the San Francisco area and come to you because you are board certified. That's another question that some of these doctors that have testified were not board certified. And, you know, a lot of the viewers had a problem with that and the jurors had a problem with, we don't know if the jurors had a problem with that because the case is still ongoing, but you are board certified.
I will say people do, because of the issues that like you were mentioned there, we actually have people flying from all over the country, even some people from all out of the country as well coming in because anyway, watch the video. It explains what to look for in the clinics that you're interviewing. So if you're in Los Angeles, there's like literally a checklist of what to watch out for. It's red flags so you don't get stuck in a scam. There's also this whole oral K therapy. They mail order it to you and just fraught with all sorts of holes that it just,
ordering medications through the mail, I guess, from places like Canada, never a good idea, I would say, but if it's expensive, the therapy, but if it works, how do you put a price on being pain free? Listen.
You can easily put a price. You can see what is the price of other medications, of lost work, of disability, of not having, you can quantify this and it's very, very clear the direction of where things should go.
Yeah. Thank you, Duty Ron, for the super chat. Great guest. Thanks for the education, Dr. Kaveh. Duty Ron's a big fan, and I'm a big fan of Duty Ron as well. Cat Lady, thank you so much for the super chat. Thank you both for speaking on this topic openly and honestly. Well, somebody's got to, right? I'm not a cupcake, as it says over here somewhere. That's my motto. I can't make everybody happy. I'm not a cupcake, and I'm going to talk about the hard topics. And if they want to demonetize me, well, then go right ahead. Lynn, thank you for the super chat. As an MH professor, it's concerning that Dr. Sally said she had seen 20 to 30 cases of MBP. This is extremely rare. Most clinicians never see a case. I never did in 25 years in the field. Interesting. Thank you, Linda, for the super chat. I have FND and scary, not knowing when it's going to happen, and mine look like strokes. What's FND, Doc?
Functional neurological disorder. Linda, good to see you on. Shout out to you.
Linda's you're one of your big fans, I'm sure.
Yeah, similar to conversion disorder, and it's what we talked about. What people call supratentorial, and a whole nother can of worms that absolutely deserves attention and awareness, and is surprisingly overlooked by so many, if you will, specialists. I'm not saying the specialists are unaware of this, but in the current system, it's just so difficult to really address the patient what FND is and how to successfully overcome it, because it can be overcome, but you need to be talking about it. You can't just pretend it's not there or gaslight the individual and expect it to get better.
Yeah, so true. Hi, Sarah Adams. Sarah, thank you, Sarah. Sarah has CRPS, and I know they used fentanyl in IV. I'm not sure if she's referring to the Maya case or, here, wait, let's try. It's ironic. We don't have a law allowing us to take Mary J. I've watched a lot of military SEALs take mushrooms for mental health. I don't know where you're located. It's ironic, but we do allow Mary J. in most of the states in the US now, right? It's legalized pretty much.
Or at least decriminalized, yeah, legalized
Mhm.
is, as you know, a whole bunch of
We have
different gradation.
dispensaries here now, even in New York, which, is usually a very conservative when it comes to, uh, drugs. Anyway, Amber Gloria says, "You probably already covered this, but what is the time frame for tapering off K? I have a friend doing clinicals in a K clinic and curious."
Tapering off depends on what it's being used for, how long it's been used for. So there is no, it depends on the indication, etc. So there is no way to answer that without more information. I'm sorry.
Okay, yeah, we don't wanna give, speculative answers. We can't be speculating. Sarah, thanks again. Is it normal to use fentanyl with CRPS IV?
Yeah, we do use that medication for pain very often if there's an acute exacerbation. Now, for CRPS, opioids are traditionally not believed to be helpful, but oftentimes individuals with CRPS are coming in for an exacerbation. And the question is, what triggers the exacerbation? Maybe it's like a twisted ankle or a bummed elbow or post surgery or something. So maybe we can address the new source of pain with the medication you mentioned there, even though we know it's probably not going to do much for the actual nerve transmission problems that
Mm,
underlie CRPS.
yeah. I had some other questions from the trial, actually, if we get back to that. Are there effects from K use, and is weight loss a side effect and or abdominal pain?
Very good questions. Weight loss is typically not. Abdominal pain is typically not, though it has been described. The majority of side effects from K are observed in recreational users. The indications that we're talking about for anesthesia, chronic pain, mental health, or CRPS in infusions, at least, which are used for a finite, usually maybe a handful of infusions a year, that load is so low that side effects are virtually absent. The only possible one that is still very rare is having like what we call a bad trip, where an unpleasant experience comes up in an
Mhm.
unguided or an unprepared individual undergoing a K experience. So that's the most likely. Still very rare when done ethically and responsibly.
So, do you know if abdominal pain is a side effect or can be caused by CRPS?
It certainly can. Typically, CRPS is seen in the extremities. It has been described in the trunk. I've seen it as well. I've seen it in the chest. The abdomen, it can happen. It's going to be more rare than other places, but certainly possible. And these are harder to diagnose because it's just so much less common. Like literally, it's maybe 1 for every 10 are going to be somewhere outside the extremities.
What about constipation? Can it cause constipation?
CRPS on its own, probably not, but like the comment is saying, certainly those pain medications can cause nausea and constipation.
I meant K, actually. Can K cause constipation
Oh,
as a side
typically
effect?
no, no.
No. Is it addictive?
It absolutely can be. This is what makes it different than other psychedelics. We don't think of the others whose names I won't say as having that same addictive potential. Although I certainly have observed it, we don't typically consider them that way. Um, a whole nother discussion as well. But
Right.
the interesting point is that the mindset that one is using the K for makes it far less likely to become a drug of abuse or to foster an addiction. So,
Mhm.
fortunately, when used once again in a compassionate, mindful, responsible way, is surprisingly not an issue.
What about withdrawal? Can it cause a withdrawal symptoms? Or just
What typically no withdrawals form when there is tolerance or dependence on a substance or a chemical. And K is not used for a continuously long enough period of time for there to be withdrawal symptoms. I've certainly never observed this. I'm not familiar with it because it really doesn't happen.
Right. It's one of the arguments that we're seeing in the trial is that the hospital is trying to say that Maya was addicted to K. That's why she came in screaming for it. And she must have been in withdrawal. And that's why she was irritable and belligerent. And they have some of the nurses have her yelling profanities, and that it must be a result of her dependence on it and withdrawal symptoms of it.
So I do need to say that when we're talking about that specific context, the uses of K for chronic pain and especially for CRPS are a little bit longer and more continuous than for mental health or for other indications. I still never observed a withdrawal from it. But if it's going to happen, it's going to happen in a case similar to what Maya underwent, where it's being used for longer periods of time, for more consecutive days, for example. So it is still, it would be very hard pressed to say that type of behavior is from withdrawal from K versus from unmitigated pain or any other number of surrounding environmental factors that would be affecting someone that age to be so frustrated and so angry, right?
Right, right. So if a patient comes to you and they tell you that they have CRPS and they want to have some treatment for CRPS, do you confirm the diagnosis? Do you believe what the patient's telling you? Do you request their prior doctor's medical records? How do you handle that patient?
That's a really good question, and it does depend on every patient's going to be a little bit different. But
Sure.
in our case, first off, gold standard for CRPS is a little bit difficult. There's a tremendous amount of subjectivity involved. If you look at the Budapest criteria, really the only objective thing on there is looking at if there is discoloration or loss of hair, bone demineralization. Some of them are actually not even included in the Budapest protocol. You can do DEXA scans to try to convince yourself. It's by and large still a relatively subjective diagnosis. If someone already comes in with a diagnosis, then that, honestly, what more do we gain by adding more cost to working something up? If their previous diagnosis, past failed treatments, and the rest of the story adds up and they meet the Budapest criteria, well, then I don't need to go around ordering more expensive fancy tests. If it's a first time someone is presenting, it's actually pretty uncommon because usually people are presenting to their primary care doctor because they've not heard the word CRPS up until now, maybe,
Right.
to even think that they have it until someone has already incepted it in their mind, if you will. Not incepted it in a nefarious way, but just it's like you don't know that you have a certain condition if you've never heard of it.
Right.
So
Sure.
in those cases, we can certainly do the diagnosis. It's just so rare because usually people already have a confirmed diagnosis and have failed the stepwise therapy that most, as I'm sure your audience is aware of, most individuals typically work up through before they ever try anything like K.
Right. So you're not, I mean, they're also, another thing they're pointing out in this trial is that, how did these doctors not request all her prior medical records to make sure that I don't know if that is, the standard of care, or if the referring doctor gives you their medical records and confirms the diagnosis, or if you just say the patient's coming in with, patient's coming in with a diagnosis and I believe what the patient's telling me.
And it's tough in a hospital setting. We do have this saying in medicine, trust but verify. The question, though, is what are we trying to, how does the treatment plan differ based on what the diagnosis is? So, for example, someone's coming in with tremendous pain, and we know that K can be effective for the type of pain that they're describing. We know what the risks are. In an acute situation, which is what a hospitalization is not like this chronic therapy. It's someone's coming in, you're being hospitalized for urgent or emergent matter. I'm not going to tell people how to do their job. They're doctors. They went to medical school and residency, and they should be board certified, et cetera. They can make up their own decision. But in my experience, you always have to weigh the urgency of the situation and what the potential treatments are. Once the dust settles, then we can put on our detective hats to figure out, okay, what was the root cause? Now that we have someone who is not, writhing in pain, or someone who is not actively, in the case of most other conditions, like their appendix is not bursting, their gallbladder isn't inflamed, they're not having a stroke, not having a heart attack. You have to address the initial issue first. This is where Western medicine is so effective, because it helps us address those things to allow for the root cause to be established when the patient is at least comfortable.
Right. One more question, then I promise I'm going to let you go. After this, I'll just let you have some closing thoughts, because I know I've already kept you over your time, but I appreciate you spending all of this time with us. Thank you, Lynn, for your super chat. Meant with respect. You talk about long-term effects of meds. But is that being weighed with the possible outcome of self-unaliving due to untreated pain? Seems that is too often overlooked.
No, Lynn, great point. This is so important. So this is what maybe the beginning you weren't here, Lynn, but we said you need to compare the risks and benefits of untreated or undertreated conditions. Depression, what are the risks? Suicide, permanent IQ hits, cardiovascular risk, maybe cancer risk. I mean, the list goes on. You can't undertreat things. And if medications help, then we need to use them because you can't let people be undertreated. Same for anxiety, same for PTSD, same for chronic pain, same for migraines, etc. But how can we use the fewest number of interventions with the fewest side effects to allow someone's inner healing capacity to help them heal in a sustainable way without those side effects? That's more cost effective, etc. That is what we're proposing and advocating for, Len, just to be clear.
Yeah. Okay, I've linked your channel below, so I'm going to tell everyone who's here who is not subscribed to Medical Secrets and Dr. Kaveh to please go do so. And if you have any final thoughts that you'd like to share, I'll give you the screen for a couple seconds before you have to jump.
You have, well, first off, thank you, Melanie. You're doing such a great job of raising awareness for these conditions and advocating for people and helping them feel empowered to advocate for themselves in the broken healthcare system that most of us live in this world. But I want you all to know that you probably have more power over your health than you've ever been told. And you deserve to know in ways that you can help uncover your healing capacity, because it is often so much more effective and safer than what doctors can do for you once they've gotten you to a place that you can advocate for yourself and ultimately take more responsibility for your health.
So much, and thank you for coming to spend part of your evening with us. I guess you're 3 hours behind, so really we appreciate you so much and everything that you do to also advocate for patients and chronic pain patients and people with anxiety and depression and addiction issues. And thank you so much for being a shining light in what can often be a very sad and depressing YouTube world.
Well, Melanie, thank you so much. You had such great comments from your crowd. I hope that you keep up your good work, and I hope that your viewers appreciate just how powerful the work that you do is to help them advocate for themselves.
Thank you so much. All right, everyone. Thank you for tuning in. I'll let you go. You go, and then we'll chat later, and I'll answer some remaining questions. And hopefully we can do this again real soon if you want to come back.
Would love
You're
to.
welcome to come back anytime. Thank you, doctor.
Take
We'll
care.
talk soon. Isn't he awesome? I just loved him just from his watching his videos myself. So I'm so glad that he got to come on. Hopefully it was helpful for you guys to get a little more insight into what K-therapy really is and what it's used for and how it can be really used to help people. I think that so many people had such a bad connotation of the drug by itself because it had been known as an illegal street drug. You know, before this trial, so many of us thought that it was, something that really had a bad stigma attached to it. And it can be used for pain treatment, and it can be used for depression and anxiety and addiction. And I've watched some of his videos. And if you have not seen some of his videos, it's very interesting. He actually puts a patient under, and we sort of follow him through this journey that he goes through. And he had been very, depressed. And it's sort of like, if you've ever seen anything about ayahuasca therapy, it's sort of like that. And then the patient describes what it's like after the treatment. And yeah, I mean, it's expensive, but listen, so is Botox, right? So it's all about where you want to spend your money. I mean, how do you put a price on pain relief? I don't know. And then there's reasons why the government doesn't, the government, we don't have insurance. There's reasons why insurance in the US does not cover it. We didn't get into that, but we could get into that some other time. If you guys are interested, I can definitely bring him back and talk about it again. Hi, Glow. The staff was intimidated by Beata Kowalski, that should say, because she knew what she was talking about. She documented everything. She was very knowledgeable and maybe a bit forceful. Somebody felt inferior. Sally, I think you meant to say Sally. I agree with you. There's also another case. The plaintiff, testified, I think yesterday. Her name is Kashir. They also have a case against Sally Smith for the exact same thing. And they didn't talk a lot about that case, but I have a show planned on that case and others that involve Sally Smith. Interesting to note that that family is also represented by Greg Anderson's law firm and also defended by Hunter and Shapiro's law firm. So it's there are other cases out there accusing Sally Smith of the same things that are being alleged in this case. If you guys have any other questions. Yes, Sarah, I did notice that too. I did notice that, and I found that interesting. Perhaps they were a little more, I don't want to say belligerent. I want to say they were more forceful advocates than they're used to seeing in that hospital. There's a lot of testimony that we still need to unpack together. And what I'd like to know is what testimony you would like to see with me, because there is no court tomorrow on this case. So I have tomorrow open. If you would like to watch some testimony together, let me know. I've had a lot of requests for the Sally Smith proffer. I don't know if you want to watch again Sally Smith's live testimony and Kathy Beatty's live testimony, which were interesting. I also found that going back and watching Dr. Elliot Crane's testimony was very interesting. I was doing that today and took a lot of notes, and he is supposed to be their pain management expert, the defense's, and he said a lot of things, in my opinion, that can be used against them. So please, yes, Julia Cochran, the one yesterday with Anderson blew everything up. Are you talking about Dr. Corcoran and the whole IJ report? Yeah, they're going to have to turn all that stuff over. And it could be interesting, because what is also very interesting is that Hunter and Shapiro, as you know or may not know, were involved in the Kowalski case in real time. So while Maya was in the hospital in October 2016 through January of 2017, Hunter and Shapiro were being consulted the entire time she was in there. You know who wasn't being consulted? Risk management. Because we watched the testimony of Dr. Napolitano, who told us that he never even knew about this case until he read it about it in USA Today in April of 2023. Hi, Cat Lady. Thank you for your super chat. Defense wants juror 1 released for bias and his Polish background, among other things. Well, that's interesting. Hi, Skoda. Attorney Melanie, can we talk about the IJ issue and how plaintiff played the defense? Yeah, that was excellent lawyering, which we've seen a lot of. And I don't know if that was strategic or if that sort of came out, or if Dr. Corcoran brought that to their attention, outside of court, and then they decided to grab onto it. But I thought Hunter's reaction to that information was very interesting, because he can't say he didn't know about it. He's been involved in this case in real time since 2016, in addition to many, many other cases against the hospital. So it's very, very interesting. Hey, Cheryl, thank you. 500 people in the chat. Please hit the like button and please subscribe. It is free. And hit the bell so that you'll get all notifications when I go live or post a video. Most of my stuff is live because quite frankly, I hate editing. So it's a very interactive chat, and it is a very kind chat. And it is a very nice community we're building here. Hi, Wes. Monday deposed, probably followed by disbarment. I don't know who's being deposed on Monday. I thought somebody's being deposed tomorrow regarding those, somebody from the hospital. I don't think anybody's going to get disbarred over this. I hope they don't. That would be tragic. Let's see. Hi, sweet one. Defense played plaintiff, then exposed themselves, opening the door for defense to question the hospital's claim to being highly favored. You are correct. They're trying to play it off like it's just the cardiac unit. I don't think that's going to work. So it's a problem. Appreciate this live. Thanks, TJ Bits. Appreciate you. Appreciate all of you guys who have joined my membership. Melanie's Little Cupcakes. Thank you all so much for wanting to join. It is a lot of fun. Yes, Purple Prose. Hunter had guilt all over his face the whole time. I was listening to a lot of it in the car, so I didn't get to see his face, but I will go back and look for that reaction. Dracula rises again, Melissa says. Yeah, he called that. What didn't he call that? I thought I put that Dracula away for a long time, but yep, here it is. Thought I buried the Dracula. Sounded like an admission of guilt. Yeah. because he knew it was a problem, something that bites him in the neck, right? Isn't that what Dracula is? Yes, hello, Ruby. Go back and look at Jay Hatch's expert hospital administrator named Mr. Anderson. He pulled the pin on the grenade that blew up the case. Yes, we did that. If you want to go back into my playlist, my Maya playlist, or I can link that episode below, I called it Battle of the Experts. And I put the testimony, the original first day testimony of Dr. Corcoran, who is the plaintiff's expert in hospital administration policy and procedure, up against the testimony of Mark and Dr. Mark Anderson. And we did evaluate them and we rated them against each other. And we felt like, yes, Mr. Anderson blew it up for them. Was not good. Definitely was not good. Hi, Sarah Gray. Wouldn't Hunter and Shapiro be a conflict of interest since they were on the original trial? Well, this, you mean, I don't know what you mean. This is the original trial. This is the first trial of this case. They were on the case when she was in the hospital. I don't think it's a conflict of interest because they are defense counsel and that's who the hospital would consult with. But depending on what they saw or were involved in, they could be called as a witness in this case. That would be a conflict of interest, but we haven't seen that happen yet. Hey, Carolyn, thank you so much for the super sticker. I appreciate you. Skoda, in my opinion, plaintiff baited the defense with Corcoran's original testimony and defense's Anderson witness. I think we just covered that. Yep. 100%. Hi, Lynn. How are you? I feel bad for whining at Anderson to try to hurry up, and he was laying these pieces out. Yeah. Yeah. You know, like I said in the beginning, we did not see his shining moments in the beginning of the case because his direct examination was not as stellar as a lot of his cross-examination has been. But, you know, look, and I've said this too, it's exhausting. Being on trial is exhausting. Being on trial for 3 days in a row is exhausting. Can you imagine the number of weeks that he has been on trial? And he has pretty much single-handedly examined almost every single witness. Greg Anderson has, whereas the defense team has a whole team. It's exhausting. I don't know when he sleeps. So, you know, we have to cut him a little bit of slack, but I think he's doing an excellent, excellent job. Hi, Speak Life Garden Homestead and Permaculture. I just love you for advocating for us pain patients and those affected by other issues. In this case, I could cry. Having people care about us and take action is rare. Sincerely. Oh, thank you. Really? Is it really rare? I will say that when I started covering this case and I was watching it on some of the channels like Law and Crime and Court TV, I found the chats over there to be incredibly toxic and just mean and full of such hatred and vitriol that I was shocked by it. But I guess, look, you guys have been on YouTube a lot longer than I have, so I guess you're kind of used to that, but I don't like it. And I'm not going to tolerate it on this channel. So now we get to, hi, Purple Pros, we get to see Jay Hatchko, aka Feds. Sandy, we have great people here. We do. Thank you. Yeah, you know, we have this little sign here. Be nice or leave. That's another motto that we have. So listen, there's a way to respectfully disagree and to respectfully debate without personally attacking people. And that's what I try and emphasize here. So hopefully we're doing a good job and you guys feel safe and feel like you can speak up, because there are not a lot of safe places left in this world, if you ask me. Hi, Ray. Anderson reminds me of a combo of Poot from Murdoch and Ben Chu from the Depp trial. You don't know what he's doing until it's done. Yeah, that's a great point. Hi, Laura. I jumped from Law and Crime to Channel 13 because of the vitriol. Yeah, it's just nasty. I don't know. My moderators are the best on YouTube, so I appreciate you moderators so much. You guys are amazing. They really police this chat and they just don't let the bullying happen. And we're not going to let it happen. So feel safe here. Hi, Naya. The report the plaintiff referenced is not a Joint Commission report. It's a CMS report. And if this report was a focused inspection vs 3-year review, then it will not come in, unfortunately. There's been a little bit of conflict about that. So we still don't know what that report is. And it'll be interesting to see. But yeah, you could be right, but they haven't turned it over. So as far as I know, they were supposed to, I think, turn it over today. Like, that judge is not, he's on his last nerve pretty much. He's really on his last nerve. He has promised this jury that they were going to be out of here by, I think, November 8th, or they were going to get the case by November 8th. I'm sure a lot of you who are watching it daily know more than I do, but they're running over the time. Yes. Yeah, I will agree. Recovery Addict has an excellent place to watch the coverage. He does it all day long. I don't know when he sleeps either, because a lot of times he goes live at night as well. And he has a very kind chat as well. And yeah, sometimes you can hear the attorneys talking about the jury questions and other things, and he does broadcast it. So it is very cool to hear all of that stuff. Thank you, Sarah, again for your support. Appreciate it. Lynn said they didn't. Judge Carroll went off and widened his order. I know. Now he wants, because I heard the argument this afternoon. The female attorney for the defense, I forget her name, but she was, Judge, I really don't understand what it is that you exactly want from me. I really don't understand. Come on. Like, you know what he's looking for. But he did then broaden it. So maybe she should have just said, like, Judge, okay, we'll give them, 2 years before and 2 years after. I mean, any report that came out in 2018 is going to cover the period before. So that was kind of like a little disingenuous in my humble opinion, but, just my opinion. But you're going to get my opinion if you ask for it. So hi, Team Brittany, and thank you for being an amazing moderator. Thank you for honoring Ethan this past week. I had to do the replay, but that was too sweet. So just very touching. Thank you. Thank you for that. And if you haven't seen that, I did attribute the other night to Ethan Chapin, because there were some Kohberger hearings covered last week by everyone on YouTube and every channel and every law and crime, court TV network about Kohberger. Okay, the motion to throw out the grand jury indictment was denied, and the judge allowed cameras in the courtroom, but he's going to control the cameras. That's all that happened. Okay, I could sum that up for you in 3 seconds. Everybody covered it. You know what else happened that night in Moscow at Sigma Chi Fraternity House? The first ever Ethan Chapin Memorial Scholarship was awarded to his brother Hunter. Ethan Chapin is a triplet. For those of you who don't know, all 3 of them went to University of Idaho together. And his whole family was there for this award ceremony, and it was beautiful, and nobody covered it. So I covered it the other night, and nobody's really viewing it because it's not salacious, and it doesn't say anything about Kohberger in the title. And I did that on purpose, because that case, in my opinion, should not be about Kohberger. Every time Kohberger sneezes, everybody covers it. It's about the victims. And thank you for appreciating that, because I thought it was really important, and it wasn't about views or clicks for me. It was about doing the right thing, and paying respect to the family and the way that his family has handled this, the tragic loss of one of their children, and how they've turned it into something positive. They made a foundation. They collected over $125,000 in donations to fund this scholarship fund that's going to be ongoing every year. They partnered with a tulip farm to name a variety of tulips after Ethan. And his mom wrote a book, and they've said publicly that they're not even going to go to the trial. They're just done with it. They just want to move forward and focus on their other children. And, if you want to watch it, watch it. I'm not going to tell you to go watch it, but the interview that his parents gave just recently, and it's coming up on a year. It's coming up on the 1-year anniversary of that massacre at the 1122 King Road house. And the way that they have handled this with such grace, and the interview was beautiful, and I just wish that everyone would watch it, and I can't understand why nobody's covering it. So I'll get off my soapbox. Thank you, though. Thank you. I'm glad that you appreciate it. Thank you, Sarah. I love that you focused on Ethan's family instead of BK. Thank you. Yes. Poise and grace in their family. That is true. And yes, Cheryl, I did say that they are going to allow cameras in the courtroom for Kohberger. We still don't know when the trial is, but the judge just wants more control over the cameras and what the cameras are focusing on. And I think that's the right call. I think he needs to control it, because every hearing that I've seen that's been televised so far in this case, first of all, the audio stinks. You can't hear anything. The camera is focusing on the profile or the back of the defendant's head the entire time. Let's focus on the people that are speaking so that we can hear what they're saying and how they're arguing. I mean, that's what we're here for, right? The twinning is real. You lose a piece of your self-esteem, Brittany. Those triplets will forever be incomplete because of the loss of Ethan. I know. It's terrible. It is terrible. All right, so let me know what you want to cover tomorrow. I have tomorrow free. So if you want to do some stuff tomorrow during the day, some testimony on Maya, we can do a catch up of the important testimony. And you let me know what you want to say. Hi, Karina. Judge Carroll hasn't come to play silly games, mate. Thank you, Melanie from Brisbane, Australia. Thank you for watching from Australia. I know it's tomorrow there, right? It's Friday. I can't believe how fast the days are going and the months are going. It's kind of freaking me out a little bit. Kind of freaking me out a little bit. Thanks, Kim. I do feel safe. A few days ago, I came here. Mr. Anderson will be allowed more time. No jurors will be taken out due to the questions asked. Yeah, I agree, because I think the last thing that anybody wants is an appeal because they weren't given enough time to present their case. So I think that more time will be granted. I think you're right. I don't think any jurors are going to be taken out. And listen, when you allow the jury to ask questions in a case, this is what you're going to get. And as an attorney, you picked that jury. You had the opportunity to ask those jurors any questions you wanted about their personal bias, their personal opinions, their family members. You picked that jury. In New York, as I've told you guys several times, we don't allow jurors to ask questions. It's the attorney's job to get the information that they need. And you see from hearing these questions in this case that the jury is asking, they're incredibly smart, incredibly well-versed in what is going on. They've got exhibit numbers, they've got witness names, they're taking notes, they're paying attention. There's at least one person in healthcare, at least one person in law enforcement or retired law enforcement, and they're really smart. And some of the questions that they ask are things that we all wanted to know. So they're doing a lot of the work, and I really don't see a juror getting kicked off unless there's some crazy thing happening behind the scenes, like what happened in the Murdoch trial with the clerk. That is jury tampering, in my opinion. And like I did that live about Murdoch being remanded for a hearing. That did happen, and he is going to get a hearing regarding a new trial, because what that clerk did in that case was like far beyond the bounds of anything that should ever happen with regard to jury tampering. And I also think that the judge in the Murdoch case is going to be taken off that case because he's a witness. He's a witness because Miss Becky came to him and he knew that Miss Becky talked to that juror, pulled that juror into her office to question that juror about the Facebook posts and all this craziness. And the judge is on notice of it, and it makes him a witness. And I think he's going to be taken off that case. So sometimes I come to you as a lawyer. Sometimes I come to you as a mother. When I did Ethan Chapin's memorial the other night, tribute, that was me coming to you as a mother and not spewing legalese and legal opinions at you all night long. Hi, Skoda. In my opinion, removing that juror won't help. The facts of the case don't support the defense, which is why they're scrambling and desperate and have been all over the place. Yeah. Yeah, that's like they're scattering, right? They are getting afraid. It's just like, just get out your checkbook. I think there have been a lot of efforts maybe to settle this case, but I think the Kowalskis are trying to make a point for the rest of us so that this kind of thing doesn't happen anymore. It's shining a light on the privatization of DCF and CPS in certain counties because, Sally Smith's company wasn't making money unless they were needed, unless they were taking children away. So why is it that in Pinellas County, a child was 2.5 more times or 7 times? I don't even know the correct statistic. Let's just say 2.5 more times to be taken away than in the counties in Florida that have public DCF systems. Follow the money, like I say. So we'll see. Also, what else I kind of want to talk about? I want to talk about the social media posts that they showed of Maya having fun at homecoming, going out for Halloween. There was a picture, I think, that they did not show the jury of her in a two-piece outfit, let's say, for Halloween. And when Maya got back on the stand to refute the fact that she was not in pain and that just because she went out for Halloween, and then she got kind of like really mean at Shapiro about like, I didn't even post these pictures. Did you go on my friend's account? And now you're looking at my friend's social media accounts. That was a side of Maya that we haven't seen yet. And I'd like to know your opinions on that and how you think the jury is going to handle that. But I'm going to tell you that in many, many cases that I have handled, social media is so often used against plaintiffs. And I would tell my clients, do not post anything. If you are going to come to a deposition and testify that you can no longer ski because of the accident that you were in when you were hit by that tractor trailer, they better not come up with a picture of you skiing from your social media, because that will sink your case. I don't think that those pictures indicate that she's not in pain or that she is not suffering, because we know that this is a disease that waxes and wanes. And in fact, that is something that Elliot testified to that I was listening to earlier today. I just don't know. I don't know how they're going to interpret that. But, there are some people who will think, well, she went out for Halloween, so she must be totally fine. In my opinion, it doesn't mean a lot. But remember, in Florida, they need all 6 jurors to be unanimous. So that is very important. Thanks, Laura. Also, there was another witness the other day, the one, her name is going to escape me right now, but I'm going to say that she was a nurse practitioner who was pretty unshakable. And that testimony was very, very interesting. Hey, Matthew Frank. Maya didn't post. That's the thing. Her friends did. And that's what she pointed out. She said, those were my friends' posts. How did you even go and find them? She felt even more violated. Yeah, but like I tell my kids, you guys, it was a private account. Apparently someone who doesn't like Maya had access to it. Creepy. Oh, Cynthia Main. Hi. Yes, that's what they said. Defense counsel said so many people emailed us these pictures. It's like I tell my kids, okay, just because you put something out there on the internet and you delete it, it's there forever. It doesn't mean it's gone. And there are a lot of people that are hating on the plaintiffs in this case. And you see it in the Law and Crime chat, and you see it in the Court TV chat, and you see it on other stations in the chat and on other channels. And you see it. So it doesn't surprise me at all that there are people trolling out there looking for this stuff and emailing it directly to the defense attorneys, just like in the Richard Allen case, that rogue employee photographed all of the evidence and the crime scene photos and leaked them out to a bunch of YouTubers. There are people out there who will sabotage you at every turn. And it's insane, but it happens every single day. So yeah, exactly. They've got nothing better to do. Everybody hit the like button. Gamer Ducko, what, in my opinion, are the chances Shapiro will get to go on that vacation? When is his vacation scheduled for? I keep hearing about this vacation, but I don't know when it's going to be. And with this new wrinkle thrown in here about these reports that need to be turned over, and there's going to probably be a lot of them turned over, and that's leading to a deposition tomorrow, which, in my experience, that deposition could lead to more depositions depending on what they uncover. And whether this employee who shows up tomorrow of the hospital has personal knowledge of all of these things. If this person who's being presented or who's being produced for the deposition knows nothing, they're going to have to produce somebody else. So I don't know. Oh, a day after the trial is supposed to end. Gamer Ducko. I'm going to say, well, Lynn answered our question for us. Shapiro posted his vacation's canceled. It's really hard to plan a vacation when you're a trial lawyer because you just never know what's going to happen. You just never know. Things could go on forever that you think are going to end, and then they could be adjourned. You think you have a firm trial date, you show up that morning, The other side makes an application for an adjournment for whatever reason. Our witnesses are out of the country. We can't reach this guy. We can't reach that guy. Our client, we can't find him. I mean, it happens all the time. So it could go either way. Could go either way. All right. That is it for now. We'll come back tomorrow and discuss this. Put your comments in the comments section about what you want to see tomorrow, and we'll come back and do it. I'm thinking maybe around noon would be a good time. Noon, 1 Eastern time. I'll post it. And I'm here for you. Whatever you guys want to see or cover, I'm here. Thank you to all of my subscribers, all of my channel members, Melanie's Little Cupcakes, my moderators, and my replay viewers. I love you guys so much. I could not do this without you. And, look, be kind, be cool, be classy. It's not hard. I'll see you guys soon. Peace.